Hello everyone, welcome to Real Talk with Mima. Here we talk honestly about health, wellness, and the realities of gender and sexual based violence within our society. I'm your host Jemima, and here we dispel myths, harmful practices, and educate you with knowledge that creates change. So, whether you are a survivor, a health advocate, or somebody simply willing to learn, you're welcome. Let's learn, let's create change one conversation at a time. So, today is the 31st of January 2026. Do you know that January was slated, the whole month of January was slated for cervical cancer awareness for 2026? A lot of people do not know what cervical cancer is, and for those that knows it, some do not know how to prevent it, and some having difficulty trying to see if they should take steps in preventing it. Now, why do we need to talk about cervical cancer? Cervical cancer is the leading cause of cancer death in women. It's the leading cause of cancer death in women all over the world, Nigeria, and the world in general. Now, why is it important? Usually, cervical cancer does not come with any symptoms until it is too late, until in the late stage of the disease before you can get any symptoms. And at that point, little or nothing can be done to salvage the person. Okay. So, what is cervical cancer? Cervical cancer is the cancer that affects the lower end of the uterus, that's the cervix, or as other people know it, the womb. The lower end of the womb, the cervix, cervical cancer affects that place. Now, why is it important? Like I said, the symptoms are not really seen until when it is too late, when nothing can be done. But calm down, calm down. There is hope. Hope in the sense that early detection is the best way to treat cervical cancer. Early detection and other measures. But now, let's talk about the symptoms of cervical cancer. Remember, I told you don't usually get symptoms until it is a bit too late for anything to be done. So we talk about pain during sexual intercourse or bleeding, whether during sex, after sex, or in menopausal women, or in between your periods, is a sign of cervical cancer. Then foul smelling vaginal discharge is also a sign of cervical cancer. So what can be done? Now, first, like I said, screening. We have the pap smear. You can go for screening. This screening is usually important for those who are sexually active. Why? Because this virus, the human papilloma virus, that's the causative organism for cervical cancer, is transmitted through sexual intercourse. So people that are sexually active are encouraged to go for pap smear to detect. There are other ascetic tests that can be done, especially in low to middle income countries, that this test for pap smear is not available. They can go for also ascetic test on the cervix. This pap smear helps to detect the cells of the human papilloma virus that causes cancer within the cervix, and then treatment is done quite early before this cancer sets in. Like I said, it is not preventable once the symptoms have set in and the cancer have gone far. So we can do the test, right? First, prevention. Second, how do you also prevent it? By vaccination. Vaccination of girls between the ages of 9 to 14. This is very important because sometimes various things causes this, right? Like I said, it's transmitted through sex, especially those with multiple sexual partner. Now, you may have just one partner, but your partner may also have multiple partners, where infidelity comes in, right? So this can predispose you to be at risk of cervical cancer. So, and then always remember, safe sex practices prevents the risk, reduces the risk of getting cervical cancer. The use of condom. So if you cannot be faithful, always remember to use a condom. Now, like we said, go for testing. For our children, young girls aged 9 to 14, we go for vaccination. Why do people usually shy away from this? Is because of the shame of having to go for pap smear, and then sometimes the cost. Is a very expensive test, but there are organizations that offer this test for free. And also vaccination is very expensive, but then last 2 years in Nigeria, free vaccination was given for girls aged 9 to 14. So remember, be safe out there. Cervical cancer is real and is killing a lot of people. So just because January is slated for the awareness month and today is the last day of January, it does not mean we do not stop the awareness. Remember, here we talk about health and wellness. Go out there, spread the word. Let's be safe out there, and then our health is important to us. Thank you for joining us on today's episode, and we wish to see you on our next episode when we discuss various things regarding health, wellness, and issues of sexual and gender-based violence. I'm your host, Jemima. See you on the next episode. Don't forget to like, subscribe, and leave a comment.